Set up in 1969, the Mahatma Gandhi Institute of Medical Sciences is India's first rural medical college, located in Sevagram, Maharashtra. Working to instill a gender lens among young graduates, the institution believes that sensitizing students about the social determinants of health can go a long way in improving the quality of care that they provide as medical practitioners.
When teaching is concerned, we have to follow the guidelines of Maharashtra University Health Sciences and of National Medical Commission. So whatever is the curriculum that is being taught to students. When we arrange this orientation camp in Bapu Ashram or social service camp in the village, that provides us opportunity to demonstrate to students something about the gender. So we have a little space, but within that I think we are contributing, and credit goes to these people.
This issue differs from other issues that we have a defined field practice area where we have lots of intensive work, community mobilization activities, our whole belief system where we believe in participatory methods and engaging people in the services that we are delivering out. Not only engaging people, actually we say the services are owned by people. So there is a concept of community ownership on which we are working in this issue.
Let us take an example of a community, where we have to understand that gender plays very important role because it's a social construct and is a very important determinant of health and disease.
A really great sensitization to gender and intersectionality as well. Sex is what is assigned at birth and gender is more of a social construct, but there was also the intersection of things like people with disabilities, the LGBTQIA plus community, and how accessible spaces are important.
These terms are hardly discussed. It's like taboo words. So getting to discuss these, the whole diversity, explaining things, that makes a huge difference. So the best way that we found was to look at the curriculum and identify existing opportunities where we could introduce gender.
Number one, my students need to understand how gender plays a role for healthcare accessibility. Number two, how can gender play a role when patient enters into the hospital? Number three, how our policies can affect one particular gender? And number four, how our textbooks are sometimes gender biased. Then gender integration is not so time consuming task. Sometimes just giving some data can also sensitize students about the gender, and sometimes you also need to require to take a one separate class for it, but can be very well done within the given framework.
Working only on one aspect, gender, is not possible, and you have to talk about social determinants of health or in terms of intersectionality, and also understand other factors which give rise to inequity in the society.
In the social service camp, undergraduate students learn about everyday rural life as they adopt a family and understand their health needs while living in the village for 2 weeks. I believe and we believe are 2 to 3 day experiential workshops that use games and dialogues to bring reflexivity for undergraduates and postgraduates towards existing societal and health inequities. The use of innovative methods such as power walks, gender matrices, poetry, and field demonstrations of teaching tools make these workshops especially memorable for students. Additionally, the gender lens is applied while delivering concepts in RMN-CHA and community medicine, and students are encouraged to explore it in their independent research projects.
Not every UG student is going to be a public health person. I know that. They are most of the time going to be a clinician, going to be a private practitioner. At least they understand the barriers one particular gender may have faced to come to their OPD, whether it is a male or female. Both have a different type of vulnerabilities because of the gender norms. They should be aware of it. Then only they can provide a very sensitive care to them, which they need.
When we actually went into the field, I think the stories that I've heard, I won't be exaggerating if I say that they completely changed my life or they changed the way I look at things. completely. Life situations we see that the problems are more often systemic. It is that the system failed these people, that they weren't able to get from point A to point B in time. They weren't able to afford the healthcare that they deserve, that they need. And that actually made us sit and wonder that it's not these medical causes. If only these people, if Summa was, from a socioeconomic strata as all of us sitting here, she wouldn't have died. And once you have that kind of sensitization, I think at your end, you're trying your best to advocate for these people, because they don't often have the platform to do so themselves. But we often have the power to make at least some sort of change, to actually, that's what we were taught about advocacy. It is, speaking truth to power. And I think that makes all of us great advocates, and I don't think that is seen in colleges anywhere else where people are as passionate about advocacy.
So I think it is more important that you understand the values of these things which we are doing and how we are doing. Any medical college can take it up and try doing it, but then you have to have a leader and you have to have commitment. These are only two things which are required, and if there are people like this, they will change.